The CEO of the American Diabetes Association, Tracy Brown, recently discussed how a low-carb diet has drastically improved her diabetes. She explained that a low-carb diet has helped her discontinue the use of insulin and reduced her dependence on prescription medications. Dr. Mark Cucuzzella practices family medicine in Ranson and Martinsburg, West Virginia. He is a professor at the West Virginia University School of Medicine and conducts continuing medical education courses on health, fitness, and running through Health Fit U, and he developed the U.S. Air Force Efficiency Running Program. In his clinical practice, he prescribes medical nutritional therapy as a cornerstone of diabetes management and reversal. He himself is a diabetic, and he joins us today. The CEO of the American Diabetes Association, Tracy Brown, recently discussed how a low-carb diet has improved her diabetes. Have you seen this in other patients?
Oh, my gosh, yes, John. So, it's so nice to see someone, who is in a position of leadership of an organization such as the ADA, who actually has the disease. Not that I wish the disease on people, but if you're going to run an organization, it gives you just amazing insight into living with diabetes and what it's like to manage diabetes. It's very hard outside of that to understand the drivers of blood sugar. Mm-hmm. So she, obviously, just by listening to her story, she's been her own experiment of one, has probably tried every method that's been taught to her to manage her blood sugar, either by, food or medications. And, along the way, this low-carbohydrate approach isn't anything new. It's been in the ADA guidelines since about 2011, but it's never been really, it's kind of hidden in the papers. They say, kind of individualization of therapy, whatever that means.
Yeah.
But translation from something in a 100-page clinical guideline into clinical practice and down to a level of an individual patient is a very long process. So, not many citizens out there with diabetes in 2011 would interpret individualization of therapy, meaning, well, maybe I should try a low-carbohydrate diet. But that's a dietary pattern that is in the ADA position papers for management of type 2 diabetes. You could eat more carbohydrates and sugars and use more medications, or you could eat less carbohydrates and sugars and, potentially, most people I see in practice use less medications because, as the ADA papers share, which she's very familiar with as the president of that organization, that the leading contributor to high blood glucose is the amount of glucose in your diet. Mm. That should be self-evident, so she decided to go down that path, not just in the last few months. There was a follow-on little 4-minute YouTube where she's just kind of explaining her story. So she's been on this approach for several years and stopped her insulin several years ago. But finally, kind of like maybe it's the shot across the bow, maybe first time actually came. It takes a lot of courage, I think, John, to be able to come out to say something that isn't entirely supported by the organization that, is paying your salary. And that you're really the captain of the ship, right? You're the spokesperson for the scientific side, for the patients, for the doctors, so you're trying to, manage all of these key constituents, to an organization like the ADA. So she must have felt strongly enough that this needed to be out there to share her own personal story.
It seems like it would be kind of a seesaw effect, a fine line, if it's easy to start eating more carbs and to switch the pendulum back in the other direction where you have to go on the meds. Are you finding that in patients?
Oh, yeah. I give people a choice, and I'm in the hospital right now rounding, and I'm in West Virginia. 80% of the people I see in the hospital have diabetes, and they're in the hospital for a condition related to their diabetes, whether it's heart disease, heart failure. We have people here with diabetic ulcers, other more infections because, diabetes affects your immune response. We've got about 8 people with influenza now in the hospital, but these are your sicker diabetic patients. They're frail. Yeah. They can't fight these infections. So, yeah, it's not a diet. It's a lifestyle choice, So, if you find that, by your Western lifestyle, you became a person with diabetes, you've eaten the standard food pyramid, as we all were taught, and, you've gained weight, and then you have diabetes. Now, if you want to reverse that condition, you have to do the opposite of what got you there. But these foods are addictive. I mean, and most of what we deal with is more, psychology therapy, treating the behaviors and the food addictions and the patterns, like anything, whether it's alcoholism or opiate use or tobacco. Your body craves these things, and the foods have hijacked the brains of children with all the sweet things they get. And now you're telling them, okay, sorry about what we told you for 20 years with the low-fat diet. We were wrong, and maybe the eggs are. I've been teaching this for 8 years. I don't have any problem coming out. But 10 years ago, everything I told people was absolutely wrong.
Yeah,
like Tracy, I developed a type of diabetes myself, and it turned it all on its head.
Were you able to reverse it in your case by low carb?
Yeah, I kept it in checks. I was in the military and had an A1C above 6. My type of diabetes is the low insulin production type, more on the type 1 spectrum. Most of the type 2s are insulin resistant, making too much insulin. They just can't store anymore. But the bottom line is, both of those groups can better manage their diabetes by not putting kind of fuel in the fire, so to speak, so less carbohydrate.
Yeah.
So I've kept myself off medications, not with perfect A1Cs, by, eating probably 20 to 50 grams of carbs a day for 8 years. It's kept me out of trouble. So I feel good. So that's my road. If I could go the other road on medications, or I can go on this road, and you take it a year at a time. And if ultimately I need to be on medications, I'll still be on the same diet. But the diet's the primary management tool.
Yeah, once you get on a diet, and you say it's not a diet, it's a lifestyle, but once you get on it, it becomes easier and easier, whether it's
delicious.
Yeah. You want to have that roll every now and then or something, but it really is.
Actually, after like 8 years, you really don't. I have a continuous glucose monitor. If I had half a roll, my sugar would be 250.
Yeah.
So to me, I'm over maybe the first couple years. But now it's like you put a nice big salad and a ribeye in front of me and a roll. I mean, there's no way I would even want to even look at the roll, because the other stuff is way more delicious.
Yeah.
And you feel better. Just how each individual is going to need to make their own choices. But when your body starts feeling healthy and feeling good, that's addictive. I mean, and you wake up and you want to go exercise. You don't need to snack all day. You see patients, it brings me joy as a clinician, John. If I can go in the room and the patient's off medications and feeling great, that's a fun visit. It makes me want to go to work tomorrow.
Yeah.
If everyone's getting sicker and more medications, then none of us feel good about that, the patient, me, and that just burns doctors out, and patients get disease fatigue. It's managing diabetes is difficult, time-consuming.
What are your recommendations? Obviously, diet for people with diabetes, but if you have patients that you're concerned about and you want to prevent them from getting it or reverse it, what are your recommendations to them?
Yeah, so to prevent diabetes, we need to go back in. So you can't, you have to regulate toxins that are causing disease. So this is not individual personal responsibility. So one of the organizations I'm involved with is the Low Carbohydrate Action Network. So we're trying to influence the dietary guidelines of America. So what do we feed kids in school? Once a child becomes obese, which is heading to diabetes, your window to reverse that is almost gone. Those kids, their odds of becoming a normal weight as adult is near zero. So we need to go into the schools. I was just in a school a couple weeks ago doing a project, and the average grade school child in my state is having about 1.5 to 2 cartons of chocolate or strawberry milk fed to them by free, right? This is free school lunches. This is fed by the government. And do you know how many grams of carbohydrates or teaspoons of added sugar in a carton of strawberry milk?
I have no idea.
It's about 7.
Yeah.
Now the WHO, that's just one, right? Most kids are having one for breakfast, one for lunch. They're on free school meals. The WHO, even kind of like caving a bit to the sugar. I mean, it should be 0 added sugars, right? But so they say for a child, top would be 6 teaspoons a day of added sugar. So here we are feeding children under the government guidelines for free in the school with a carton that's saying, drink your milk. It's like a healthy-ish looking carton. And that's their dairy, because, that's insane, right? So we're pretty much, poisoning these kids literally in school in plain sight. We need to go at that level. So I'm an advocate, right? If the scientists don't get in the room and speak up. My hospital that I'm working in right now, we got rid of sugar drinks 2 years ago, all sugar drinks for patients, staff, break rooms, vending machines, visitors. And they can go across the street to 7-Eleven and get it if they want, but we're not serving it in our hospital.
Doctor, thank you so much. I know you're making rounds today.
Thank you.
You've got people you have to deal with. So thank you for taking some time out to talk to us about this important topic about diabetes. So I appreciate it.
Thank you for caring and listening. Spread the word.
That is Dr. Mark Cucuzzella, who practices medicine in Ranson and Martinsburg, West Virginia. And his clinical practice is the West Virginia University Center for Diabetes and Metabolic Health, where he prescribes medical nutritional therapy as a cornerstone of disease management and reversal of diabetes. He himself is a diabetic. Patients fighting cancer need nearly